The median nerve travels across the wrist and gives you feeling to these fingers, and running over the nerve is a transverse carpal ligament. Carpal tunnel syndrome is a compressive neuropathy, which is where the transverse carpal ligament that runs over the median nerve causes external pressure on the nerve, and that can lead to numbness in the fingers and also weakening of the muscles in the hand. Carpal tunnel can just arise out of normal hand use, but also it can be associated with repetitive activities, such as typing. Oftentimes, construction workers with heavy-duty impact on the hand, like a jackhammer, can suffer from carpal tunnel syndrome. Non-operative treatment can include bracing. Some people will prescribe some hand therapy. Cortisone injections are also useful in either diagnosing or treating carpal tunnel syndrome. Carpal tunnel release is the surgery that's used to treat carpal tunnel syndrome. So again, the median nerve travels across the wrist and gives you feeling to these fingers, and running over the nerve is a transverse carpal ligament, and that is the ligament that thickens with repetitive hand use and puts external pressure on the nerve. So the release surgery is dividing that transverse carpal ligament, which opens up the space for the nerve and allows more blood flow to the nerve, and that will help with the hand numbness and the muscle weakness. So there are two ways to do the carpal tunnel release surgery. There is the traditional open, which requires a longer incision. It's approximately 1.5 inches. And that recovery can take anywhere from 2 to 4 weeks to be back to all the usual activities. There is a more minimally invasive approach, which is the endoscopic carpal tunnel release, and that can be performed with a smaller incision, about 1 centimeter or 1/2 inch, and it's it's performed with the use of a camera and an internal blade that cuts the ligament from the inside out. There's less pain associated with that, and therefore the recovery is typically quicker, and most people are back to work within 2 weeks. There is a slightly higher risk of nerve injury with a more minimally invasive surgery, but that risk is still quite low.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.